Hello and welcome to another episode of Time to Chat with Dr. Judith. I'm pleased to be here again with Dr. Judith to discuss a very exciting new treatment that we're offering. Is that correct, Judith?
Yes. It's a group coaching model and it begins in June. So it's really, really exciting to be able to talk about it today.
Yeah, it's really great to be here. It's a beautiful sunny day here in London. And we're all sort of feeling full of the joys of spring, but it's been a busy week for you the last couple of weeks, isn't it, Judith?
It's been really, really busy. I was on Alex Partridge's ADHD Chatter podcast. I have a live session coming up with Dr. Louise Newson on Thursday on her YouTube channel, which is not something I normally do. I'm going to be honest, I'm outside my comfort zone. But
Nice.
I'm hoping that we can basically reach and help more people. That's why we're doing this.
Nice, that's great. And we had, last week we also launched ADHD Answers.
Yes, for professionals. So we're running through the second cohort of ADHD Answers for professionals, and that's going really well. I'm really delighted to be working with some great clinicians,
Nice.
therapists, doctors, psychologists, coaches, professionals. It's going really well.
It's going great, and it's really nice to see the impact that the work is having, right? It's kind of, yeah.
That's why we do it. We do it because ADHD can be quite complicated. The science can be quite complicated.
Yeah.
But once you understand the science, actually the solutions are quite simple. So that's the bottom line. The science is complex. The solutions can be simple and really, really powerful.
Cool. Well, should we get into that? Let's talk about ARC. So what is ARC?
What is ARC? It stands for Awareness and Regulation Coaching. And it's a group coaching model, 6 sessions online over 6 weeks. And it's designed to give people the skills that they need to begin to develop their awareness of their ADHD and also how to regulate. So that's why it's called Awareness and Regulation.
Nice. And so for someone who has maybe had an ADHD diagnosis, or maybe someone who doesn't have an ADHD diagnosis, do I need to have gone through that formal process of getting the diagnosis before coming along, or what does it
No,
look like?
you can come along without a formal diagnosis because it's designed to be usable even if you have traits. So you don't need to have the diagnosis formally to come along. And it's also been designed to be usable alongside medicines. Not everybody with ADHD is able to get a diagnosis or wants to take medicines, but if you are on ADHD medication, it's a useful thing to use alongside as well. It's the kind of adding the skills to the pills, so skills as well as pills.
Nice. I like that, skills as well as pills. It kind of rolls off the tongue, doesn't it?
It's designed, because ADHD is complicated, trying to communicate clearly what we're doing is important, because I'm not anti-medication at all. Medication is really useful for many people, but we know only about half of the people with ADHD will take medicine either because it's not helpful or they have side effects or they can't tolerate it. And so we do need to be providing better input for people, better support.
And you've showed me before, there's some, correct me if I'm wrong here, you're the science expert, but there are studies out there that show that the greatest effect is
well, there's lots of different things that have been shown to be beneficial. So the reason I developed ARC is because I teach doctors to diagnose and treat ADHD. And when we look at the evidence for different therapies, actually the evidence is kind of mixed and not that great. So I thought, well, let's try to start with the science and work up from there and look at what the differences are in the ADHD brain and therefore what we might then offer people. And that's why we focus very much on self-regulation and awareness, because self-awareness is one of the key parts of executive function, and it's often a difficulty for people with ADHD. So if we begin with awareness, using adapted mindfulness techniques that we can use when we're walking around, when we're doing something else, we begin with awareness through mindfulness. And we know that mindfulness has an evidence base in ADHD.
Nice.
So we start there, and then we also add in the education piece, the group support, the executive function comes in later on, and also how we integrate things like exercise, because we know with ADHD there is dysregulation across both neurotransmitters and networks. And because the brain is designed to seek equilibrium, the brain always wants equilibrium. Some of the things that we do that seem really simple are actually really, really powerful because it helps the brain regain equilibrium.
I like that. That's cool. I'm curious. So we know that psychoeducation is great for ADHD, or great for. What is the difference between ARC and something like CBT or DBT, or is this too sciencey?
No, it's a great question. So CBT was developed in order to sort of treat and manage depression. And in CBT, there's a lot of kind of thought. There is a self-awareness in terms of developing awareness of thought patterns, but then there's also lots of thought challenge. and the assumption that thought patterns in depression may be in some way flawed. And what we find in ADHD is often there's nothing wrong with people's thoughts. It's more to do with their energy, to do with how motivated, able to focus they are, and how they're able to regulate their energy. So it comes from a very different place, really. So CBT, as I say, was developed for depression. It's been adapted to be applied to many, many, many different things. And some of the techniques that we use within the model would have come from the CBT arena,
Nice.
but it's not pure CBT.
It's kind of things plucked.
It's a hybrid.
It's a hybrid. I like that. It's new.
It's new. It's a hybrid, and it's developing. We'll be developing the model as we work through. And it's come from 5 years working as an ADHD specialist, just looking at ADHD, working with ADHD, coaching people with ADHD, and going, actually, what we have isn't quite right. So let's see if we can make something that will work better.
Nice. I'm just going to jump in here as well. We've got some people watching from home. Now, I've got plenty of questions lined up to ask Judith, but we are monitoring the comment section on both YouTube and LinkedIn. So if you're watching on any of those platforms and you have questions for Judith, please do pop them in the chat box, and we'll keep an eye on those, and happy to ask Judith as they come in. Now, a question I have for you, Judith, is so I've heard it's group coaching.
Yep.
Surely, I mean, I've got lots of personal things I want to talk about. Do I want to bring those to a group setting? Tell me, why group?
So group's really important because within a group, we begin to see that other people have similar issues. And one of the main issues in ADHD is ADHD shame. Because if you spent your entire life struggling to do something that seems really obvious and simple to other people, and you've got no idea why, then you often have quite significant feelings of shame. And coming back to the CBT piece, when we see CBT and also sometimes executive coaching, you see people being given advice that they can't implement because they have ADHD. It's like, well, I would do that if I could. Like, it'd be great to make a list and go to the shops and buy what's on my list of food. I can't do that. I've got ADHD. I actually need an ADHD specific intervention. So the group works really well because we reduce shame, and we realize that actually within the group, everybody has similar difficulties, maybe slightly different areas that they struggle with, but we're sharing our shame, we're coming together. And also you learn so much from each other. I learn all the time from my clients.
Yeah.
I've learned more from my clients than I have from anyone else. Hello. Should we just shut the door?
Yeah, sorry, I've just left the door open. Won't be 1 second.
Hello.
Sorry about that. That's the joy of broadcasting live from home.
Broadcasting live from the living room.
That's excellent.
Now,
Good.
as
Yes.
we were,
Yes.
so the science.
The science, yes. So the science of ADHD is fabulous because I'm a geek at heart, and I like nothing more than sitting down and hyper-focusing on an article about the default mode network. But that's me. That's just who I am. Not everybody wants to sit and wade through all these, trials and papers and models. But the science is complex, and once we look at it all, we'll say, well, actually, what we can see is this dysregulation, and that's the take home. In ADHD, it's not deficit, it's not excess, it's dysregulation. And because the brain seeks equilibrium, we can use some quite simple techniques to regain that equilibrium.
Nice.
Yeah, does that make sense?
It does, and I think one of the key pieces of feedback we received from the launch of ADHD Answers last week, which I really liked, is, as you say, the science is complex, but you have the way of kind of absorbing the science and sort of teaching it in a way that's really digestible and that anyone can get their head around. And there's something really powerful about knowledge, right? It's like when you understand what's going on inside your brain, you can kind of better regulate and better kind of empathize with yourself.
That's the really key point, what you just said there, which is we tend to kind of ignore, I've given lifestyle advice for years and really struggle to follow it myself. I find it hard to get a regular exercise routine going. And what I learned when my ADHD traits were at their worst was that actually I have to privilege the ordinary. I have to make the ordinary stuff that I do really important, because that's as powerful as medicine, because it's helping my brain regain equilibrium. So it's really privileging the ordinary. And we had some feedback from the Alex Partridge podcast last week, somebody saying, what's new treatment, what's the medication? It's like, it's actually not a medication, it's a way of seeing. It's a way of seeing what we do, and seeing that what we do as individuals is important. And the reason I love doing it is that when I teach, and I've been teaching for years, people take advice away and then they take the doctor with them, and then they don't necessarily need me again because they've got the advice and they're enacting it. And your body has all sorts of ways of regaining equilibrium through sleep, through exercise, through being connected with other people socially, through nature. There's lots and lots of things that our bodies are designed to do, we've evolved to do to regain equilibrium, but we've got to privilege it. We've got to make it important. and see it as special as a new medicine.
It's really interesting that, isn't it? Because it's like, I think there's some, and I mean, I'm guilty of this, the idea of, oh, well, take a pill and it'll fix it.
Yeah.
But actually, in the long run, there's a lot to be said about learning about it and, understanding the feelings you're having. And yeah, it's quite a different way of thinking about it, right?
It's very much the kind of, skills alongside pills, because I know from years of experience as a psychiatrist, the medicines do work very often, but they work better when there is also some psychological support, some psychoeducation, some lifestyle change. They work really well when you're using all three parts of that triangle: the medication, the therapy, and the everything else. When it comes together, you've got that magic triangle that really does help people change their lives, it's really exciting. So yeah, it
is exciting. It's great. Now the nuts and bolts of it: when, where, why, how, who.
So who is mostly you, Hamish,
yeah,
and me, but no,
behind the scenes.
So the when, where, how is you can book online. I think we're going live at 1 p.m. today, aren't we, through the website?
We are. So the website will be up to date live to take bookings for the first module of ARC at 1 p.m. today.
Yep, which is module 1. In module 1, we discuss getting to know your ADHD, really understanding how the science shows up for you in day-to-day life and what you can do to regain regulation. Running that from June. It's a limited number of places because we want to make it a proper group experience, make it safe for everybody, make it enjoyable and values-led. So that begins in June on Thursday evenings, I think, isn't it?
Yes, Thursday evenings, the 5th of June.
Yep. The 5th of June, yeah. So we start then. After that we'll be rolling out further modules in the autumn, but that's to be launched later in the year.
Nice. And I think something to say as well is we've had a lot of inquiries from sort of all over the world. If this cohort time doesn't work for you, there will be multiple different cohorts at different times of the day. So there's plenty of scope in that space.
Absolutely.
One thing I did just want to touch on as well, something that if you're not quite ready to commit to the full 6 weeks, we do have introducing ADHD as well.
We do. Yeah, and that starts next week on the 8th of May. So the plan with that is that's going to be a monthly session for people perhaps who've just been diagnosed with ADHD or who want to learn more about ADHD. And it's an online kind of session to really give you that education so you have an understanding of the ADHD construct. And that's available 8th of May.
8th of May is our first.
And a single session.
A single, yeah. And when you say monthly, it's a single session that's repeated monthly. So you purchase one session, turn up for 2 hours and kind of get that introduction, and then you can decide, right, if you want to go into the full
absolutely.
arc.
Yeah.
Wonderful. Now we do have a question that's come in, and it's specifically around vicarious trauma.
Oh, wow. Okay.
Yeah, so we're diving right in. So we've got someone who's extremely empathetic and considering studying psychology at university. They've recently been diagnosed with ADHD and anxiety. And sort of there's 2 questions here. So firstly, around the risk for someone with ADHD and anxiety going into a helping profession, what would you, I guess, warn against with someone who might be at a higher risk of vicarious trauma with that diagnosis?
So with ADHD, I'll often talk about the strengths and the struggles. So empathy can be a huge strength, and many people with ADHD are extremely empathic. So it can be a huge strength, particularly in a role like psychology.
Yeah.
The struggle is that if you're hyper empathic, sometimes you can get overwhelmed. And as we know, ADHD is a very overwhelming condition. And so what I'd say is to see both sides of the coin. If you're very empathic, notice that, be thankful for it, and at the same time, look after yourself. And that means making sure you've got social support, making sure that you're not doing too much, you're not overexposed, recognizing the things that might trigger you to feel overwhelmed, recognizing where your boundaries are. And that it does require a degree of self-awareness, and it takes practice to do that. But certainly if everybody who is empathic didn't go into psychology, would be in trouble. And you may well find that actually your ADHD has a huge strength in a career like that.
That was really helpful, because I think one of the big questions there was, is this a terrible idea? Should I stray away?
No. And the other joy, people with ADHD often really thrive on novelty, because novelty is stressful and leads to increased noradrenaline, which helps with focus. So we may find if we're in a career where you see a new client every day, actually the novelty is great. So certainly I found psychiatry was a great career because of the novelty of like meeting new people, coming up with new solutions. That kind of combination of novelty and creativity is a very sort of ADHD strengths pattern. And so you may bring your strengths as well as your struggles.
I like that. That's wonderful. Thank you. It looks as if that's it for our questions for now. I would just say,
you mentioned vicarious trauma.
Oh yes, thank you.
That's okay.
Now my brain's gone away.
That's okay. I was listening.
Thank you. Look at this. This is wonderful. We're both keeping ourselves on the path.
Yes.
I guess more broadly, the question is around vicarious trauma for those people with ADHD. So,
yes. Yeah.
How does that manifest?
So vicarious trauma basically means people experiencing traumatic responses to other people's traumatic experiences, or to traumatic experiences they're exposed to secondhand. And we see it in many caring professions, emergency services. We see it in lawyers who work in traumatic areas, so family law. Maybe they work with survivors of violence, or with refugees, or work in criminal law. So we see it in lots of different situations, and you get the features of a trauma response, even though the trauma is experienced at secondhand. It's linked to hyper-empathy, and the management is similar to that of PTSD in that we see people benefiting a lot from lifestyle interventions, rest, recovery, psychological support, EMDR, and embodied movement. So we use a similar kind of approach for vicarious trauma.
Nice. And I think the question that linked back to, it was back to someone who's considering studying psychology, and the risk of, if they became someone like a psychologist, the risk of them opening themselves up to vicarious trauma, being an empathetic person. But that's not necessarily, as I understand it, it's not necessarily going to be the jump straight away. There might be
no. And I think we have to be wary when we experience strong emotions. Strong emotions can hurt, but they're not in and of themselves dangerous. So if you experience strong emotions, it's working out how to process those.
Okay. And I guess in something like psychology, you'd probably find this at universities and things like that. It would be...
You would hope so.
Yeah.
It varies. You would hope so.
Right.
Yeah.
Wonderful. Well, one last thing I wanted to just point out is so for people who might be watching the replay of the live and don't have a chance to write in at the moment, we are going to be running also on the 8th of May. It's a busy day, the 8th of May.
It is.
We're running another live webinar. This will be, instead of it being a time to chat like this, it'll be a chance for people face-to-face on Zoom to actually ask questions of Judith for half an hour. So that will be introducing ARC and answering any questions people may have about the ARC program. So if you're watching the replay and have your questions, come along to that. It's all the details are on the website, ADHDEd.co.uk. Book online under the little blue button, and all there.
Brilliant. Thank you.
Do you have anything else you wanted to?
No. Thanks very much for everybody who's listening, and we'll hopefully see you soon.
Wonderful. Thanks, everyone.
Thank you.